outbreak was discovered along a conflict zone where the World Health Organization has limited access, making containment efforts a major global challenge. To give us more details from the ground, we now go live to our correspondent, Ariana, reporting from the outbreak zone. Ariana?
Thank you, Devery. I'm here at the border today because of the panic that continues to rise as local health officials confirm the rapid transmission of the Novaflu virus. Experts say the infection spreads through respiratory droplets and contaminated surfaces, putting thousands at risk, especially the crowded areas with weak healthcare monitoring. Containment is on the way, but without full international cooperation, the virus could cross multiple borders within days. Back to you in the studio for more updates on the global responses.
Thank you, Ariana. Following the outbreak, the World Health Organization has officially declared Novaflu a public health emergency of international concern. For more coordinated global response, here's our correspondent, Jubilee.
UNICEF have launched awareness drive to fight misinformation, while the World Bank and IMF have approved emergency plans. Pharmaceutical companies across the globe have begun early vaccine development to ensure fair access once treatment is available.
The situation is critical, but we are united. The World Health Organization is activating international health regulations, negotiating for border access, and deploying medical teams for affected regions. We urge everyone to remain calm, follow official health advisories, and reject misinformation together. We can overcome this crisis through global cooperation.
During these times, every hour counts. We're facing shortages of supply, but we remain committed to saving lives and stopping the spread. Despite the exhaustions, we keep going. The support from international partners give us strength to fight for our patients and our community.
Health Organization is now coordinating with border governments to open humanitarian corridor for medical teams. Environmental units are disinfecting public spaces and improving waste management to prevent further contamination. Back to the studio for the latest updates.
Thank you, Jubilee. The question now is, how are governments and global actors handling this crisis? And how has the politics responded to these actions? To answer that, we once again turn to our reporter, Ariana.
Thank you, Tristan. I'm here with Jade today, a local resident in this area. What is your view on how the government and the international organization respond to the Novaflu outbreak?
So honestly, I think the government acted quickly with lockdowns and information drives, but in some areas still struggle to get medical aid on time. I do appreciate the global groups like World Health Organization and UNICEF in stepping in. Their coordinations brought hope and resources when we needed them the most. It's not perfect, but seeing different nations work together gives us confidence that recovery is possible.
Thank you, Jade. Back to you in the studio.
Governments are now on high alert. If containment fails, emergency protocols including lockdowns and travel bans will be enforced immediately.
Citizens are urged to stay informed, cooperate with health officials, and remember that fear fuels the spread. Novaflu reminds us that times of crisis, leadership and unity matters most. The world must learn, adapt, and strengthen cooperation.
Let this outbreak remind us that compassion and accountability are as vital as medicine. Only by working together can we truly heal. Because when the world stands united, no virus can defeat humanity. This has been Global News Network.